Cold viruses, primarily caused by rhinoviruses, coronaviruses, adenoviruses, and respiratory syncytial viruses, RSV, have existed for thousands of years. These viruses emerged as a natural part of viral evolution, constantly adapting to their hosts, humans and animals, to survive and replicate. Viruses do not have a specific purpose. They exist due to mutation, adaptation, and evolution. The common cold likely developed alongside human civilization as early humans lived in close-knit groups, allowing viruses to spread easily. The origins of cold viruses can be traced to zoonotic transmissions, where viruses jump from animals to humans. Over time, they evolved to infect human respiratory systems efficiently, leading to mild yet persistent infections. The genetic material of these viruses changes rapidly due to mutations and recombination, making them highly adaptable to different environments and immune systems. Early evidence suggests that rhinoviruses, the most common cause of colds, have been infecting humans for thousands of years. Ancient viral sequences indicate that coronaviruses and other cold-causing pathogens have been evolving alongside humans since prehistoric times. The widespread nature of cold infections can be attributed to several key factors. Airborne transmission makes it incredibly easy for cold viruses to spread through respiratory droplets. As civilizations grew and people began living in crowded cities, the opportunities for transmission increased significantly. Unlike some seasonal diseases, cold viruses can infect people throughout the year, though they peak in colder months due to the tendency for people to gather indoors. Their high mutation rate allows them to continuously evade the immune system, preventing long-term immunity. Another reason for their persistence is that the symptoms of the common cold are generally mild, allowing infected individuals to continue their daily activities while unknowingly spreading the virus. This differs from more severe illnesses that force people to isolate, reducing transmission rates. Cold viruses have perfected a balance between infectivity and survivability, ensuring their continued presence in human populations. The common cold is a product of natural viral evolution and human societal changes. It persists due to its efficient transmission methods, mild symptoms, and continuous mutations. While it is rarely life-threatening, it remains one of the most widespread infections in human history, affecting billions each year. The common cold has been one of the most persistent and widespread viral infections throughout human history. While it is generally not considered severe, its impact on public health and daily life has been enormous. Historically, cold viruses have caused significant disruptions, especially in densely populated areas where transmission is rapid. Ancient civilizations, including those of Egypt, Greece, and Rome, documented symptoms resembling the modern cold. However, due to limited medical knowledge and treatments, infections often led to complications such as pneumonia or secondary bacterial infections, which could be fatal. In modern times, the common cold continues to be a major public health concern, affecting billions of people each year. The rhinovirus alone is responsible for nearly half of all colds, with coronaviruses, adenoviruses, and respiratory syncytial viruses contributing to the rest. On average, adults experience 2 to 4 colds per year, while children can have 6 to 10 due to their developing immune systems and frequent exposure to others. Though not life-threatening for most, colds cause a significant economic and social burden. In the United States alone, colds lead to millions of doctor visits and school absences annually, contributing to lost productivity and healthcare costs. Workplace absenteeism due to colds results in billions of dollars in economic losses globally. While complications are rare, individuals with weakened immune systems, the elderly, and infants may experience severe outcomes, including respiratory infections that require hospitalization. While it is impossible to eliminate cold viruses completely due to their ability to mutate and spread easily, effective prevention strategies can significantly reduce the risk of infection. Good hygiene is one of the most effective measures. Frequent handwashing with soap and water helps remove viruses picked up from contaminated surfaces. If soap is not available, alcohol-based hand sanitizers are a useful alternative. Since cold viruses can survive on objects for several hours, avoiding touching the face, particularly the eyes, nose, and mouth, can prevent the virus from entering the body. Maintaining strong immunity plays a key role in reducing susceptibility to infections. A balanced diet rich in vitamins and minerals, regular exercise, adequate sleep, and stress management all contribute to a stronger immune system, making the body more resistant to infections. Minimizing close contact with infected individuals is essential, especially in crowded places. Cold viruses spread through respiratory droplets, so covering coughs and sneezes with a tissue or elbow can help prevent transmission. During peak cold seasons, avoiding unnecessary exposure to crowded indoor spaces can reduce the risk of infection. Proper ventilation is another important factor in prevention. Cold viruses spread more easily in enclosed areas with poor air circulation, so keeping windows open and using air purifiers can help reduce viral concentrations in indoor spaces. Although there is no cure for the common cold, preventive measures can help limit its spread and impact. By practicing good hygiene, strengthening the immune system, and minimizing exposure to infected individuals, it is possible to reduce the frequency and severity of cold infections, maintaining overall health and well-being. The common cold remains one of the most widespread viral infections globally, affecting people of all ages. Adults typically experience 2 to 3 colds per year, while children, particularly those in school or daycare settings, may have 6 to 10 episodes annually. Rhinoviruses are responsible for approximately half of all cases, with coronaviruses, adenoviruses, and respiratory syncytial viruses also contributing to infections. Seasonal patterns reveal that colds are more frequent in the fall and winter months, largely due to increased indoor activities and close human interaction. However, colds can occur throughout the year, with individual susceptibility influenced by factors such as immune health, age, and exposure to infected individuals. Though generally mild, the common cold leads to millions of doctor visits, school absences, and workplace disruptions worldwide, contributing to significant economic and social burdens. Preventing the common cold requires a combination of good hygiene practices and lifestyle habits. Regular handwashing with soap and water is one of the most effective ways to prevent infection, as it removes viruses that may be picked up from contaminated surfaces. When soap and water are not available, alcohol-based hand sanitizers serve as a useful alternative. Since cold viruses enter the body through the eyes, nose, and mouth, avoiding face touching with unwashed hands can help reduce the risk of infection. Respiratory etiquette also plays a crucial role in prevention. Covering the mouth and nose with a tissue or elbow when coughing or sneezing helps prevent the spread of respiratory droplets. Proper disposal of used tissues and immediate handwashing afterward further reduces transmission risks. Maintaining distance from sick individuals, especially in enclosed spaces, can lower the likelihood of infection. Those who are unwell should consider staying home to prevent spreading the virus to others. Frequent cleaning and disinfecting of commonly touched surfaces, such as doorknobs, light switches, and mobile devices, help eliminate lingering viruses. Cold viruses can survive on surfaces for hours, making shared objects potential sources of infection. Ensuring good air circulation indoors by opening windows or using air purifiers can also reduce the concentration of airborne viruses. A strong immune system provides an additional layer of protection. Getting adequate sleep, maintaining a balanced diet rich in vitamins and minerals, engaging in regular physical activity, and managing stress effectively contribute to overall immune health. While no vaccine exists for the common cold due to the vast number of viruses that can cause it, adopting these preventive measures significantly reduces the risk of infection and helps maintain overall well-being.